The most common type of breast cancer is invasive ductal carcinoma. 80% of breast cancers are that. The second one is lobular carcinoma, or invasive lobular carcinoma. And both men and women have ducts. So yes, women have more breast cancer, but men also can develop breast cancer. So our main diagnostic tools for breast cancer include the mammography as well as ultrasound. So most people know of the screening mammogram. This has undergone some changes recently in that it used to be films. All x-rays were films, and mammograms also were films. And so you would have these films that you'd have to look at to determine if there was anything abnormal. They then went to digital mammogram, where they were able to look at it on screens and use computer-aided detection to help try to detect more things that would be wrong. With a 3D mammography, the x-ray machine itself moves, from what I understand. But the breast itself is actually compressed during the movement, and so they're able to see different tissue as it's being compressed, because what the mammogram does is that it compresses the tissue enough so that we can see something that isn't compressible, which is suspected to be a cancer. With the lumpectomy, that has to be coupled with radiation, otherwise the mortality rate is higher than for a mastectomy. But when you couple lumpectomy with radiation, then the mortality rate goes down to the same as if you would have the whole breast removed. Lumpectomy, or also known as partial mastectomy. So a partial mastectomy is where we remove the cancer itself and some normal tissue around it, getting negative margins. The margins are the edges of the tissues that we remove. There's a range of stuff that can be done, from placing expanders immediately after a mastectomy to actually going straight to implant. A lot of times we can spare the nipple as well and not just the skin, and so there are much better cosmetic outcomes than there were from the initial treatment of breast cancer. For breast cancer, just be aware of your body, because it can happen when you're 20, it can happen when you're 30, and it can happen when you're 80. And so just being aware of your body and noticing if anything changes and being very much an advocate for yourself is one way that you're going to be able to have that early detection.